This course begins with a question that appears simple, but quickly proves to be among the most difficult questions human beings can ask. What is justice? People often approach justice as if it were a matter of personal belief, cultural habit, or political allegiance, something shaped by upbringing or emotion rather than reason. Yet the purpose of this course is to treat justice not as opinion, but as a philosophical problem that demands careful thinking, argument, and self-examination. Philosophy does not ask us what we feel about justice. It asks us what we can justify. That distinction is crucial. In everyday life, we constantly make moral judgments about fairness, rights, responsibility, and punishment, often without realizing the assumptions behind them. Philosophy slows this process down. It exposes the principles we rely on, tests them against hard cases, and asks whether they can be defended when intuitions conflict. To do this, the course uses moral dilemmas not as entertainment or intellectual games, but as instruments for thinking. These dilemmas place us in situations where deeply held moral beliefs collide, forcing us to confront the structure of our reasoning. When a dilemma makes us uncomfortable, confused, or divided, that discomfort is not a failure, it is the starting point of philosophical insight. Justice, in this framework, is not a fixed doctrine handed down by authority, but an ongoing inquiry into how we ought to treat one another. It involves questions about life and death, freedom and coercion, equality and hierarchy, intention and responsibility. By examining these questions philosophically, we aim to cultivate what might be called moral self-knowledge, an understanding of why we believe what we believe, and whether those beliefs can withstand scrutiny. This inquiry matters not only for abstract theory, but for real political and legal decisions that shape societies. Laws, institutions, and policies rest on moral assumptions about justice, often unexamined. By bringing those assumptions into the open, philosophy invites us to become more reflective citizens and more responsible moral agents. With this aim in mind, we begin not with theory, but with a concrete thought experiment, the trolley problem, which immediately brings the question of justice into sharp and unsettling focus. Imagine a trolley speeding uncontrollably down a track toward 5 workers who are unable to move out of the way. If nothing is done, all 5 will be killed. You're the driver, and you discover that the trolley's brakes have failed. However, you notice a switch that can divert the trolley onto a side track. On that side track stands a single worker who would be killed if the trolley were diverted. The moral question is direct and unavoidable. Should you pull the switch? When this scenario is presented to audiences, a large majority say yes. The dominant intuition is that pulling the switch is the right thing to do because it saves more lives. This response seems to follow a straightforward moral logic. 5 deaths are worse than 1, and when harm is unavoidable, we should choose the option that minimizes loss. Many people justify their answer by emphasizing that the driver does not intend to kill the 1 worker. The death is a tragic side effect of saving the 5. Others stress responsibility. As the driver, doing nothing is itself a choice, one that allows greater harm to occur. From these justifications emerges a powerful moral principle, often stated as it is better that 1 die so that 5 may live. This principle feels compelling in the context of the case because it aligns with everyday moral reasoning in emergencies, disaster response, and public policy, where resources are limited and trade-offs are inevitable. The trolley problem thus introduces an outcome-oriented approach to justice. in which consequences matter morally and numbers count. Yet, even at this early stage, important questions arise. Is actively diverting harm morally equivalent to passively allowing harm? Does the driver become morally responsible for the death by intervening? Is it legitimate to compare lives numerically as if they were interchangeable units? Although many people answer confidently, the case quietly embeds assumptions that will later be challenged. What appears to be a clear moral choice may depend on factors we have not yet fully examined, and the apparent simplicity of the scenario sets the stage for deeper philosophical conflict. Despite the majority's readiness to pull the switch, a substantial minority objects and their resistance reveals important fault lines in moral reasoning. Some critics argue that the principle underlying the majority response, that it is permissible to sacrifice one to save many, resembles the logic used to justify some of history's gravest injustices. Genocide, forced sterilization, and political repression have often been defended on the grounds that they serve the greater good of society. From this perspective, the trolley problem raises a disturbing question. If numbers alone determine moral rightness, what prevents the moral annihilation of individuals in the name of collective benefit? Others express unease with treating human lives as quantities to be added and subtracted. They argue that justice requires recognizing each person as possessing intrinsic worth that cannot be overridden by arithmetic. For these critics, the moral wrongness of killing is not erased simply because more lives are saved. There is also concern about moral thresholds and slippery slopes. If killing one to save 5 is justified, what about killing 10 to save 100? Or harming a minority to benefit a majority? These objections do not necessarily deny that saving more lives is better in some sense. Rather, they challenge whether that fact is sufficient to justify intentional harm. The minority view highlights a competing moral intuition: that there are constraints on what we may do to others, regardless of beneficial outcomes. Importantly, these objections push us to distinguish between explaining moral reactions and justifying them. Explaining why people choose to pull the switch does not settle whether the choice is morally right. Philosophy demands more than intuitive agreement. It demands reasons that can withstand critical examination. By taking minority objections seriously, the inquiry resists equating moral truth with majority opinion. Instead, it asks whether the principle, maximize lives saved, can be defended without collapsing into moral reasoning that treats persons as expendable. This tension between outcome-based justification and respect for individual moral limits becomes central as the course progresses, and it prepares us for a more challenging variation of the trolley problem that intensifies this conflict. In the second version of the trolley problem, the numbers remain the same, but the circumstances change in a morally unsettling way. You are no longer the driver, but a bystander standing on a footbridge over the track. Below, a runaway trolley is again heading toward 5 workers. Next to you on the bridge stands a large man. If you push him onto the track, his body will stop the trolley, killing him but saving the 5 workers. The question is whether you should push him. When people are polled on this scenario, the majority response flips. Most refuse to push the man, even if they were willing to pull the switch in the first case. This reversal presents a deep philosophical puzzle. If the moral justification in the first case was saving more lives, why does that reasoning suddenly feel inadequate? After all, the outcome is identical. Many people describe pushing the man as murder, whereas diverting the trolley did not feel that way. Here, the man's death is not a side effect, it is the means by which the 5 are saved. The case introduces the morally troubling idea of using a person as an instrument for a goal, even a beneficial one. The physicality of the act, using one's own hands to push someone to their death, also seems to matter. This suggests that our moral judgments are sensitive not only to consequences, but to intention, means, and personal involvement. The Fat Man case destabilizes the simple principle that saving more lives is always morally preferable, revealing that our moral framework includes constraints that resist pure outcome-based reasoning. Understanding why these constraints matter becomes a central challenge for any theory of justice. To make sense of the differing intuitions between the two trolley cases, philosophers explore a series of moral distinctions that may explain the contrast. One key distinction is between killing as a means and causing death as a foreseen side effect. In the switch case, the one worker's death is not the method of saving the five, whereas in the bridge case, the man's death is essential to the plan. Another distinction is between doing harm and allowing harm. Pulling a switch may feel like redirecting an existing threat, while pushing a person feels like initiating violence. Closely related is the role of personal force and physical contact. Direct bodily involvement often intensifies moral judgment, suggesting that proximity matters morally. There is also the distinction between the responsibilities of actors and bystanders. As the driver, one may feel obligated to act. As a bystander, one may feel less responsibility to intervene in lethal ways. Philosophers test these distinctions by modifying cases to see whether our intuitions track them consistently, often finding that no single distinction fully explains our responses. Attempts to reconcile the cases frequently fail, revealing tensions within our moral thinking. This struggle suggests that our intuitive judgments may rest on multiple, sometimes conflicting principles. Rather than dismissing this as confusion, philosophy treats it as evidence that justice is complex and that our moral beliefs require refinement. By examining where and why our intuitions diverge, we begin to see the outlines of competing moral theories, some focused on outcomes, others on rights and duties, that will shape the rest of the course. The moral tensions revealed by the trolley problem are not confined to abstract thought experiments. They arise repeatedly in real-world contexts, particularly in medical ethics. Consider first an emergency room scenario in which a doctor must decide how to allocate limited time and resources. One patient arrives critically injured and requires extensive treatment to survive, while 5 others arrive with moderate injuries that can be treated quickly and successfully. The doctor cannot save everyone. When people are asked what the doctor should do, most answer that the doctor should treat the 5 rather than devote all resources to the one. This response aligns closely with the outcome-oriented reasoning seen in the first trolley case. Saving more lives appears morally preferable, and the doctor's role as a professional entrusted with maximizing patient welfare reinforces this intuition. The death of the critically injured patient is tragic, but it is often described as an unfortunate consequence rather than a moral violation. Now contrast this with a second medical scenario. Imagine a transplant surgeon with 5 patients who will soon die unless they receive organ transplants. A healthy patient comes in for a routine checkup and is a perfect match for all 5. The surgeon could kill this patient and distribute their organs, saving 5 lives. Nearly everyone rejects this option, often with moral outrage. The contrast between these 2 medical cases mirrors the contrast between the 2 trolley problems. In both, 5 lives could be saved at the cost of 1. Yet in one case, the sacrifice seems permissible, and in the other, it seems abhorrent. This sharp boundary reveals that moral judgment in medicine is not governed solely by outcomes. The surgeon case is seen as a violation of the patient's rights, an abuse of professional power, and a clear instance of using a person as a mere means. The emergency room case, by contrast, involves prioritization rather than intentional killing. These intuitions are deeply embedded in medical ethics, shaping rules about consent, non-maleficence, and the prohibition against intentionally harming patients. The cases also demonstrate how moral principles function as constraints on professional practice. Even when extraordinary benefits could be achieved, certain actions are ruled out as unjust. By examining these medical scenarios alongside the trolley problem, we see that the philosophical questions raised are not artificial. They reflect the moral structure of real institutions and practices, and they demand theoretical frameworks capable of explaining why some forms of harm are tolerated while others are absolutely forbidden. The patterns revealed by these dilemmas suggest that our moral judgments are guided by at least two fundamentally different kinds of reasoning. The first is consequentialist moral reasoning, which evaluates actions based on their outcomes. According to this approach, what makes an action right or wrong is the state of affairs it produces. If an action leads to better overall consequences, such as more lives saved, less suffering, or greater happiness, then it is morally preferable. Utilitarianism is the most influential form of consequentialism, famously summarized by the principle of the greatest good for the greatest number. This way of thinking explains why people are inclined to pull the switch in the trolley case or save the 5 patients in the emergency room. It treats moral decision-making as a matter of comparing outcomes and choosing the option that maximizes overall value. The second approach is categorical or deontological moral reasoning. This approach holds that certain actions are right or wrong in themselves, regardless of their consequences. On this view, moral rules function as constraints, not goals. Killing an innocent person, lying, or coercing others may be wrong even if doing so would produce better outcomes. This framework helps explain why people refuse to push the man off the bridge or reject the transplant surgeon's proposal. These actions violate moral duties and individual rights that are not overridden by calculations of benefit. Importantly, these two approaches often pull in opposite directions. Consequentialism emphasizes impartiality and aggregation, while categorical reasoning emphasizes respect for persons and moral limits. The conflict between them is not merely theoretical. It reflects real tensions in law, politics, and personal morality. By identifying these approaches, we begin to see that disagreements about justice often arise not from factual disputes, but from deeper disagreements about what kind of moral reasoning is appropriate. The task of philosophy is not to eliminate this conflict prematurely, but to examine which framework offers the most coherent and defensible account of our moral commitments. These competing approaches are associated with some of the most influential figures in the history of moral and political philosophy. Utilitarianism was developed most systematically by Jeremy Bentham, who sought a rational, measurable foundation for morality based on pleasure and pain. Bentham believed that moral reasoning should resemble calculation, with laws and policies evaluated according to their effects on overall happiness. His ideas were later refined by John Stuart Mill, who introduced distinctions between higher and lower pleasures and emphasized the importance of individual liberty within a utilitarian framework. On the other side stands Immanuel Kant, whose categorical ethics rejects outcome-based justification in favor of principles grounded in reason itself. Kant argued that morality requires treating persons as ends in themselves, never merely as means to an end. Alongside these thinkers, the course will also examine Aristotle, whose virtue ethics focuses on character and flourishing rather than rules or consequences, and John Locke, whose political philosophy emphasizes natural rights and consent. These philosophers provide distinct lenses through which to interpret the moral dilemmas we have encountered. By connecting abstract theory to concrete cases, the course aims to show how philosophical frameworks shape debates about justice in law, economics, human rights, and public policy, rather than treating philosophy as detached from reality. This approach reveals it as a foundational force in shaping how societies define and pursue justice. Engaging seriously with philosophical inquiry carries significant risks, both personal and political. On a personal level, philosophy can unsettle deeply held beliefs and undermine the comfort of moral certainty. When familiar intuitions are subjected to scrutiny, they may no longer seem self-evident, and the loss of that certainty can be disorienting. This process has been described as a loss of moral innocence. Once we see the complexity and tension within our own reasoning, we cannot return to unexamined confidence. Self-knowledge, in this sense, is irreversible. On a political level, philosophy has often been accused of distancing individuals from practical life. The ancient debate between Socrates and Callicles captures this concern. Callicles argued that philosophical questioning weakens ambition and civic engagement, while Socrates insisted that examining one's life is essential to justice. The tension remains relevant today. Critical reflection can appear to paralyze action by revealing moral ambiguity in every decision. Yet, unexamined action risks perpetuating injustice rooted in habit or authority. The challenge is to balance reflection with responsibility. To use philosophy not as an excuse for withdrawal, but as a guide for more thoughtful engagement with the world. Recognizing these risks helps clarify what is at stake in philosophical inquiry and why it must be approached with both humility and courage. Faced with persistent disagreement and moral complexity, some are tempted to retreat into skepticism. The view that moral questions have no right answers, only subjective preferences. Skepticism can feel liberating, as it seems to absolve us of the burden of justification. If no moral claims are objectively true, then no one can be held accountable for being wrong. However, this escape is illusory. Moral questions are unavoidable because we must act, choose, and justify our actions to others. Even claiming that morality is subjective is itself a moral stance with implications for how we treat one another. Immanuel Kant argued that reason is inherently restless. It cannot stop asking normative questions. Attempts to silence moral inquiry merely push it underground, where it continues to influence decisions without being examined. Skepticism, rather than resolving moral conflict, often obscures the values that guide behavior. By confronting moral questions openly, philosophy resists this temptation and insists that the search for justification is an essential feature of human reason. Justice, on this view, is not a problem we can opt out of, but a question that continually demands our attention. The abstract tensions between outcome-based and categorical moral reasoning come into stark relief in the historical case of Dudley and Stephens, an incident that forces us to confront justice under extreme conditions. In 1884, 4 men were cast adrift at sea after their yacht sank. With no food or water, they drifted for weeks until death seemed inevitable. One of the men, the cabin boy Richard Parker, fell gravely ill and appeared close to death. Dudley and Stephens decided to kill Parker and consume his body, believing that doing so would save their own lives. The remaining sailor did not participate, but also did not stop them. Eventually, the survivors were rescued, and Dudley and Stephens were charged with murder. The case presents a jury-style moral question: were their actions morally permissible? When audiences are asked to judge the case, opinions divide sharply. Some sympathize with the sailors, emphasizing the extremity of their situation and the apparent inevitability of death without action. Others insist that killing an innocent person, especially one who is weak and vulnerable, is morally impermissible regardless of circumstances. The power of the case lies in its refusal to yield an easy answer. Unlike hypothetical trolley problems, this was a real event with real victims, making the moral stakes more vivid. The case also raises questions about responsibility under duress, the moral relevance of survival, and whether justice should make allowances for desperation. Importantly, the legal system ultimately rejected the defense of necessity, affirming that murder cannot be justified even to save one's own life. This outcome reflects a categorical approach to justice, one that prioritizes moral limits over outcomes. Yet the discomfort many feel with this verdict suggests that our moral intuitions are not fully satisfied. Dudley and Stephens thus serves as a bridge between philosophical theory and legal practice, revealing how deeply moral reasoning shapes institutions of justice while remaining contested and unresolved. Those who argue that Dudley and Stephens acted permissibly often rely on a form of utilitarian reasoning grounded in necessity and survival. From this perspective, the killing of the cabin boy is seen as a tragic but rational response to an extreme situation in which death was otherwise certain for all. The argument begins with the claim that numbers matter. One life was sacrificed to save three. If the aim of morality is to minimize death and suffering, then the choice appears justified. Supporters also point to broader social consequences. Dudley and Stephens had families and dependents, while the cabin boy, young and ill, was unlikely to survive much longer. Saving the sailors thus preserved more future lives and social ties. Some defenders argue that moral rules developed for normal circumstances may not apply under conditions of absolute necessity. In such cases, strict adherence to categorical prohibitions may seem morally rigid and disconnected from human reality. There is also an appeal to compassion and empathy. Faced with starvation and despair, the sailors acted under psychological and physical pressures that significantly impaired their freedom. To judge them by ordinary standards, it is argued, ignores the moral relevance of duress. From this standpoint, justice should take into account human limitations and the instinct for survival. Utilitarian reasoning thus frames the killing as an unfortunate but defensible act aimed at preserving the greatest amount of life possible under catastrophic conditions. While this argument does not deny the tragedy of the cabin boy's death, it insists that moral evaluation must attend to consequences, context, and the harsh realities of survival. Opponents of moral permissibility reject these arguments by appealing to categorical moral principles. They argue that murder is inherently wrong and that no appeal to necessity can transform it into a just act. On this view, allowing exceptions undermines the very idea of moral law. If killing is permitted whenever survival is at stake, then the moral prohibition against murder becomes contingent and fragile. Critics emphasize that the cabin boy did not consent and was chosen precisely because of his vulnerability, making the act not only killing but exploitation. Human life, they argue, cannot be reduced to a variable in a survival equation. To do so treats persons as resources rather than as beings with inherent dignity. Furthermore, opponents warn of dangerous precedents. If necessity justifies killing in extreme cases, who decides when necessity applies? Such reasoning risks eroding legal and moral protections for the weakest members of society. The categorical response insists that justice must hold firm even in desperate circumstances, precisely because those are the moments when moral principles are most tested. The refusal to justify murder, even at great cost, is seen as a commitment to the equal worth of all persons. From this perspective, the legal verdict against Dudley and Stephens is not cruel, but principled, affirming that justice is not suspended by hardship. In response to the conflict between these positions, some propose procedural solutions designed to make the outcome fairer. One such proposal is a lottery. Rather than choosing the weakest person, the group could have drawn lots to determine who would be sacrificed. This suggestion introduces the idea that fairness of procedure might legitimize an otherwise impermissible act. Consent also enters the discussion. If the victim had agreed to sacrifice themselves, would the killing be morally justified? These proposals raise difficult questions about what consent and fairness actually accomplish morally. Consent given under conditions of extreme coercion, such as starvation, may not be genuinely voluntary. A fair procedure may distribute risk evenly, but it does not necessarily justify intentional killing. The lottery proposal highlights the moral significance we attach to impartiality, yet it also exposes its limits. Even a fair process may lead to an unjust outcome. These considerations force us to examine whether moral legitimacy depends on outcomes, intentions, procedures, or some combination of all three. The debate over consent and procedure reveals that justice is not only about what we do, but how and why we do it. The Dudley and Stephens case, along with the trolley and medical dilemmas, leaves us with profound philosophical questions that resist simple answers. Why is murder considered categorically wrong? Is it because of the harm it causes, the violation of rights, or the kind of agency it expresses? Why do fair procedures matter morally, even when they lead to tragic outcomes? What moral work does consent actually do, and under what conditions does it transform an action's moral status? These questions lie at the heart of theories of justice and reveal the depth of the inquiry we have begun. They show that justice cannot be reduced to a single principle without loss, and that moral reasoning requires ongoing reflection, argument, and self-examination. Rather than closing the discussion, these questions open the path forward, preparing us to examine systematic moral theories that attempt to answer them.